I'm Harbir at CES 2019 at the Digital Health Summit studio, and I am joined with Dr. Harbir Singh, CEO of Convergent Health Solutions. Wonderful to have you.
Thanks so much for having me here, Arsha.
Now, Dr. Singh, I understand that you're doing some particularly pioneering work in terms of technology and community hospitals. Can you tell me a little bit about what your focus is at Convergent Health Solutions?
Absolutely, Arsha. So, at Convergent Health Solutions, what we're doing is taking all this wonderful technology that's happening, a lot of it's being directed toward the consumers, and really finding ways to implement it in the community health systems themselves from the perspective of providers. So our goal is to help these community health systems and community hospitals realize their true potential by bringing in technological innovation and innovative approaches to help decrease the cost of care, improve patient outcomes, and enhance the patient experience. So it's pretty spectacular what we're doing because nobody's looking at it from the perspective of the communities themselves and implementing these things in a cohesive ecosystem that really impacts it from a clinically validated perspective to improve outcomes and provide better care.
Now, Dr. Singh, I know that you're a physician by training. You're also have an MBA. How does your clinical background and your business background help you really kind of create these innovations or identify these innovations?
I mean, it's very simple. By having the business perspective, from having the patient perspective, having been the patient myself and family members in the patient, and then combining that from a clinical perspective, we're able to do what a lot of other people can't. 99% of people cannot achieve this because we truly understand the entire picture from what the patient needs from a clinical perspective, the digital needs, and just integrating it in validated ways that have a meaningful impact.
Why community hospitals? Why are they important to patients, the healthcare system? Why was your focus on those particular clinical sites?
So, ultimately you have to go back down to the very basic root. Where do we all live? It's in communities. We're not living in big, giant tertiary care centers. We're not living in little silos by ourselves. We're within a community. So we have to start at that level and, do the innovation at that stage.
Now, I know we talked before, and you've seen a lot of interest in terms of partners, and you're undertaking a pilot program. What kind of technologies are you thinking of or focusing on at the moment?
There's a wide variety of things. We've just been so fortunate to be in Texas and have got some wonderful partners that are interested and innovative in using these approaches to impact patient care, and the funding has been really, really great for us. So, for now we're starting with some of the things that we've already been doing is, allowing digital voice communications between patients and nursing staff, having Alexa-enabled rooms, providing more of a concierge experience. Some things down the pike that we may be looking at are using video technologies to help identify and triage patients that have a specific illness, so we can figure it out sooner and intervene sooner for a meaningful impact.
So it sounds like you're really utilizing a whole breadth of different technologies and innovations to empower these community hospital settings.
Exactly, and we're doing, yeah.
So now, as you're going around CES, you're seeing a lot of new technologies, other wellness and health technologies. Where do you see Convergent Health Solutions in the next 12 months, 18 months?
So, in the next 12 months, we're working with our prototype hospital in Texas to begin to implement some of these solutions. We've already started it, and in the 12 months, we hope to have a true prototype model for the country, that this is what's possible at the community level to really converge digital health, technology, good clinical medicine combined with evidence-based medicine. And we set that model in 12 months, 18 months, 24 months. We expect to be expanding nationally with multiple different partners to implement these solutions for our communities.
So it sounds like you're doing really phenomenal work targeting an area that's often been neglected with the very best technology. So thank you very much for your time, Dr. Singh.
Yeah, thank you so much for having me.
Thank you. Hi, this is Dr. Harbir finishing up here at CES 2019. at the Digital Health Summit studio, sponsored by Living in Digital Times. Thank you.